A 43 years old man has symptom of carcinoid syndrome. Which of the following is the most effective therapeutic agent in controlling the symptoms? So in case of the carcinoid syndrome, which of the following agent or which of the therapeutic agent use control the symptoms that in clinical feature reduced by using which of the following substances? Here are the options. Options are atenolol, octreotide, glucagon, somatostatin, and spironolactone. First of all, the carcinoid syndrome. The carcinoid syndrome, it is a special type of the tumor secretion, and the tumor secretes serotonin. So carcinoid syndrome, it secretes serotonin, and the carcinoid syndrome, it arises from the neuroendocrine cell, and the neuroendocrine cell usually in the gastrointestinal tract, but also may be present outside the gastrointestinal tract like the bronchi, and the most common site is the appendix. And when this syndrome present, when hormone symptoms mainly occurs when the disease is spread outside the bowel. And what are the clinical features? Here we can see the clinical feature of the carcinoid syndrome. It includes the flushing of the face, palpitation, pulmonary valve stenosis, tricuspid regurgitation, bronchial asthma, and severe diarrhea. So they are the clinical feature of the carcinoid syndrome. They are flushing face, palpitation, asthma, severe diarrhea. And what is the investigation and treatment? The investigation, in the urine we can find 5-hydroxyindole acetic acid, and also in the blood we can find the chromogranin A. So chromogranin A, 5-hydroxyindole acetic acid in the urine, they are the diagnostic for the carcinoid syndrome. But also there is somatostatin receptor scintigraphy and CT scan is useful. And what are the treatment? The octreotide for the management of the clinical feature, and the surgical removal is the definitive treatment. And the carcinoid syndrome, it follows rule of third: 1/3 multiple, 1/3 small bowel, 1/3 metastasized, and 1/3 secondary tumor. And carcinoid syndrome, it secretes serotonin, and the symptom present only the presence of the liver metastasis. So which is used for controlling symptom in case of the carcinoid syndrome? It is the octreotide.